Hi, everyone. This is Sean with the MassSupport Network here with your COVID-19 update for Tuesday, February 16th, 2021. So I was off last week, we'll look at a 2-week jump here in how cases and deaths look, and it's all pretty promising. Worldwide, we saw in the last 2 weeks about 4.1 million new cases. Weekly average, that's down about 600,000. Here in the United States, we saw 1.2 million new cases in the last 2 weeks, which is less, than a month ago. We were seeing that every week. That's an amazing drop off there. Here in Massachusetts, about 13,000 cases per week. In terms of deaths, these are not dropping off as much. We seeing worldwide, there was about 100,000 deaths per week in the last 2 weeks. Here in the United States, that was about 22,000, which is basically the same as where it was. So generally speaking, deaths have not dropped off much as we expect them to, but we should start to see that eventually starting to come down in the next few weeks as we get further beyond the surge from January. Just looking at how everything is going right now, you can see how cases especially have dropped off significantly, followed by hospitalizations, and deaths are starting to come down, but not as much or as fast there. Unfortunately, testing is also coming down too. There's some thought that may be because of vaccinations come up, either areas are becoming a little bit more complacent about it, or it's just the same resources that would go towards distributing tests are now going towards distributing vaccinations. But hopefully that does not lead to more hidden cases that we're not catching. Just looking around the country at where cases are right now, everything is trending downward. These are the number of new cases per million people. Generally speaking, things are coming down a lot more than they were even just a couple of days ago. No one is above 1,000 anymore, and there's only 3 states which are above 500 new cases per million. And in January, there was something like only 7 states that were not above 500 new cases per million people. Similarly, just around the country, all the regions are trailing off, with the West especially showing very precipitous decline, something about a quarter of where they were at their highest point. Everywhere else is continuing these downward trends. Others not as fast. Here in the Northeast, we're not moving down really as fast as some of the other areas, unfortunately. But we have just about gotten to our point at the spring peak. Again, with the Northeast especially, that is somewhat not representative because the spring peak cases were probably several times higher than we were able to track at that time. Whereas in the South, which is now reaching its summer peak, that's probably more accurate there. Hospitalizations are basically down to where they were in mid-November. Cases, meanwhile, are down to where they were in October, which is great. But again, we are still well above the point where we were in either of the previous surges. So we're still, things are coming down, still above the capacity we want to be at. But just about every state is falling right now. Those few that are not seeing declines in their hospitalizations are usually states with much smaller numbers and smaller, both in terms of counts and in terms of population. The only one I can see here with it showing increase is North Dakota, which again has dropped its hospitalizations a lot. So even as few people coming in on a given day could throw that number off. But here in Massachusetts, we saw a 16% reduction in hospitalizations. In terms of deaths, though, Northeast is falling more than others. The Midwest has kind of plateaued there. These sort of wiggly areas where cases are not, where day-to-day numbers are off a bit, and every so often there are some backlogs, like that big jump in the Midwest there. But otherwise, things are kind of steady at the moment, coming down from the last week's significant descent, and hopefully going to drop more in the coming weeks. So let's take a quick look at a few of the developments in the last 2 weeks there. So first up, the CDC has released some statements on masks, making cases for tighter fits and double masking in many cases, such as wearing a cloth mask over a surgical mask. This is both due to data on how the mask actually filter and to be aware of ill-fitting masks, leaving room around the sides where air can leak in and out. This is also in response to the more infectious variants, which are out there and no doubt beginning to circulate in the United States. Double masking is often, the way to go if something like an N95 is not available. But also doing something to improve the fit. You may have seen there are these kind of like mask fitters, which are basically like a mask with the middle part taken out that you put over a mask to make sure that it lines up well on your cheeks and your chin and your nose, and there aren't a lot of gaps. These are ways to just improve the protection given by masks. Also, in big news, South Africa halted its vaccination with the AstraZeneca vaccine, citing that they don't believe it was effective enough against the B1351 variant that is circulating there. Then there is some controversy on this. Some people say that it's protective enough. It may not protect transmission or even mild illness very well, but it will certainly stop death or serious illness and hospitalization, which would still be a win. That said, if you're going to dedicate the national resources of a entire country to a national vaccination campaign, you may not be able to do that multiple times. So it may be fair to try to get a more successful vaccine there. That said, the World Health Organization has still approved the AstraZeneca vaccine and does still recommend its use. So it is kind of a difficult decision there. Well, again, the protections against COVID killing someone who has the vaccine or someone hospitalizing someone who has been vaccinated, these are still thought to be fairly significant as opposed to preventing transmission, which we'd all love to see happen. Also from the CDC, they've been laying out plans for school reopenings, focusing primarily on elementary school students, seeing there's much less transmission there, and plans to, or guidelines to reopen elementary schools first, potentially even before teachers are vaccinated, citing less spread there. So there is some back and forth on there, but they are making some firm decisions that it is a much safer plan to reopen elementary schools rather than middle schools and high schools. Besides also the fact that these are clearly these students who are going to get the most benefit from in-person learning. Also, on the topic of children and more concerningly, MIS-C, multi-system inflammatory syndrome in children, is on the rise. It's something we talked about back in the early days of the pandemic and has been kind of out of the news. It is a syndrome in children who have been infected with COVID-19 and start to experience this inflammation. Affects multiple systems, body systems, hence the name, and does have the potential to be deadly. And we are seeing more and more cases of it. Now, this is likely a result of just how many cases we saw in the winter surge. And this is to be expected there, but we are seeing more and more severe ones. So more children going into ICU for this and more children dying from this. Now, it is still, as a percentage of the whole, very small, but it's still worrying. Also, it's worth noting that since children are still probably the group least tested, it's very easy to miss these and then have someone who had this past infection experience these symptoms. Checking in on the vaccine here in the United States, we've given out 52.8 million doses of the vaccine. That accounts for about 38 million people who have received at least one dose. Out of 70 million doses that have been distributed to the states. Here in Massachusetts, we have passed the 1 million doses given mark. About 1.5 million doses the state has received so far. Currently, we are seeing about 1.6 7 million people vaccinated per day, which is great. But if you do the math, that is still a long ways out to get to the 260 some million people who are eligible for vaccinations. And of course, remembering that everyone needs to get 2 currently until the Johnson & Johnson vaccine, which only needs 1 dose, gets up to production and distribution. All right, one final thought to take with you into your week. This is something a little old, but just stumbled upon recently. Little notice in the London Underground, how to cheer yourself up in 2 easy steps. Whisper beep boop to yourself. Repeat until not sad. And you can find all of our sources and data in the COVID Tracking Project, the New York Times, mass.gov, and the CDC. And for more from the MassSupport Network, you can find us on our website or on social media. And remember, wear your mask, wash your hands, and we'll be there if you need us. Stay safe.